Welcome to Oneness and Wellness. Our guest today is Dr. Larry Handler, and he's a gastroenterologist, and he's going to talk a little bit about his practice. We've got talking about some prevention and the whole system. So welcome, Larry. It's good to have you here.
And thank you, Dot. I appreciate your having me.
And I know that you have a lot of information for our viewing audience. So let's start with, I think I was talking to you before about in your profession, you work from the mouth to the anus.
That's right.
The full line. So what exactly does that involve?
Well, it involves, first of all, taking a history is critical because even in medical school, everybody teaches you if you listen and you take a history, you'll get 70% of the diagnosis. So if a person is having trouble swallowing, or they can't taste food, or they can't digest food, or they have too much gas, you can isolate it to different areas of the intestine. But even up in the mouth, people don't realize that the teeth and the tongue and the salivary glands are major parts of food breakdown so that it can be assimilated for nutrition.
Right. You talked about food breakdown. Well, one of the things that I've noticed that, when I monitor my own body, I say, I'm eating too quickly. I'm eating too fast. I have to slow down. So I recently, because I've been to Japan and Korea, and I said, I'm going back to chopsticks because that way of eating slows me right down. And I'm not hurrying. So, I think so many people do. They don't take time. The culture that we live in is if they sit down even, that's doing well.
Excellent point. And one of the most important parts of good solid digestion is what's called conscious eating. So be aware of the food going into your mouth, be aware of the chewing, the tasting, because that really is what it's all about. Eating is supposed to be a pleasure,
right,
an enjoyment.
Right. Thich Nhat Hanh, I went a long time ago to over in Newton to a workshop that he was doing, and he was saying how to eat an orange, and he did the whole thing so slowly of, look at the orange.
That's right.
And begin to peel it. I mean, I don't even do that, but I mean, it taught me something, that slow down. We're in such a hurry. If we could slow down just a little bit, I think we'd be better off.
Definitely would be better off. So in my practice when I'm treating people, if I'm going to have some success at getting them to do that, I break it down into baby steps, okay? So you're right, a lot of people eat sitting down, or standing up. So if you tell people that even though you have 10 or 15 minutes to eat, just start off slowly, sit down somewhere, read a magazine or a newspaper, or even look at your phone so you can distract yourself. Put down your fork, okay? And then just close your eyes. By closing your eyes, you can actually taste your food. And do that several times during your meal to accustom yourself to actually understand the enjoyment of eating. And that makes a huge difference.
Yeah, that's really good, the enjoyment of eating.
Right. But you have to start off with baby steps because people are so conditioned to shovel it in.
And eating things that are difficult to digest. I think a lot of people have moved away from meat, and eating big pieces of meat and so forth. So, I happen to be a vegetarian, so I don't have that problem, but you really have to pay attention. What do you think is one of the most, being the doctor in this area, what do you think is the most frequent issue that people bring to you?
I would say, believe it or not, 80% of the people I see have an entity known as irritable bowel syndrome, okay? Which in plain English means that if you understand the intestine has its normal movement, a normal motility, the motility is like a wave in the ocean, a smooth wave in the ocean. And that actually helps propel food from the mouth all the way throughout the digestive tract. Now, in irritable bowel, it affects primarily the colon or the large intestine, and people can get some very vigorous contractions, okay? And then the other part of the colon doesn't contract at all. So as a result, what'll happen is a person will either not have a bowel movement for 3 or 4 days, or they may have 3 or 4 bowel movements a day that are not complete. So basically, in plain English, what irritable bowel means is that a person is not emptying completely over a long period of time. So we've heard this thing about having a lot of residue left in the colon.
Right.
That's what irritable bowel is. And the symptoms,
yeah, go
the
ahead,
symptoms,
please.
the most common symptom is that someone feels bloated. They have gas that they can't get rid of. Sometimes they can have unpredictable bowel movements. They have to find a bathroom because they're so backed up. And nausea. They find that when they eat, they get full quickly. So there's a whole array of symptoms, but it's estimated that because of this irritable bowel syndrome, work productivity and happiness is diminished considerably.
Right. I just was talking with someone today who said, I have irritable bowel syndrome, and I find it's painful, and it, it's a really, it stops my happiness in life, So, now my husband has a different, he has, I don't know if it's acid reflux, but I think that's what it is because he takes Prilosec, and he's been taking that for a long time. And several people have told him, a friend of mine whose daughter is a doctor said, don't take that for a long period of time. It's not good. Now, I'd like to hear what you'd have to say about that.
Yeah. Well, in general, my view as a physician, a gastroenterologist, and a healer is that we overuse medication, okay? And we have to be careful about using medication without lifestyle changes and making people aware of what's causing the problem. So gastroesophageal reflux has several causes, and it means that for some reason the acid from the stomach is coming up into the esophagus where it doesn't belong, and it's causing either heartburn or belching or feeling full. Now, the major treatments thus far have been to decrease the acid secretion in the stomach so that you don't get reflux. But unfortunately, some of the medications like Prilosec are very, very strong. So it's better to start off treatment with a much milder medication like Tagamet or Zantac, along with lifestyle changes. Because once you start using a stronger medicine and you inhibit acid secretion so much, an individual can have trouble getting off of it.
Right, so that's probably what they were talking about. And, I know, I like that you say that you're a healer, and as well as a doctor who is a healer, a doctor who is looking at prevention, and trying to figure out not just to put people on any old drug, but to say, let's take a look at your lifestyle. What's causing this that that you might be able to have some way of changing, what's happening to you.
Very intuitive, because there's the expression among gastroenterologists that the GI tract is very stress-driven. It's probably the most stress-driven organ in the body. So if you double the stress, you can quadruple the GI symptoms. And the reason for that is because its nervous innervation comes from the parasympathetic nervous system and the sympathetic nervous system, which are the stress drivers or the stress relievers. So that when I take a history from a patient, I focus on the symptoms, but I also focus on what's going on in their lives.
Right.
A lot of them are undergoing divorce, which can have tremendous effects on the GI tract.
Stress.
They have a disabled child, a disabled partner. Job stresses are tremendous. So by focusing on the cause of the problem, we can give people simple baby steps to try to slowly alleviate their symptoms, and most important of all, help them understand that it's not as serious as what they think. Because don't forget, when people come to doctors, there's a certain amount of anxiety already built up in what they think the diagnosis is.
Right.
So that has to be dealt with. So it's really the whole problem. You treat the whole individual, It's called reading a person.
Right. And you know what? You were talking before, and I would like to go back to it, talking about, you know, the diet and the kinds of food that we eat. And a lot of people, you know, the big thing is you eat a fiber diet, you know, that'll take care of you. And it's not quite that simple, as I heard you saying. So maybe
That's
you'd
right.
explain a little bit about that.
That's right. Well, you know, in my realm of treating people, again, I don't like to box people in. I like to be inclusive. So when I talk to people who are meat and potatoes people or who rush through their meals, I try to get them to include basic key foods, okay? And plant food is one of the major focuses nowadays. So what we want to strive for when we tell people what to eat is give them foods or recommend foods that have the most nutrition in them. Now, plant protein, if one Googles it, are vegetations and legumes that have a high concentration of very clean protein in them. So, for example, the bean family, tree nuts, different types of seeds, the grains like quinoa and couscous and farro and brown rice. Now, these foods are unique because not only do they have clean protein, they have soluble fiber, and they have complex carbohydrates and healthy fats. So if I can ask a patient to set aside a group of foods that they can have fairly consistently, I'm getting them adapted to a very clean way of living. At the same time, I won't restrict them and say you can have steak or beef or whatever, because deprivation is not healthy.
That's not the way to go.
Deprivation.
Right.
So I really believe in lifestyle, developing discipline through baby steps, and helping people understand that they can be happier and live longer by making good choices.
So when you say the word soluble, you mean that that's something that can go through your system easily, is that
Exactly,
correct?
exactly. So there are two types of fiber. There's soluble fiber, such as we find in fruits, avocado, beans and nuts and seeds. And that's easier to go through the digestive tract. So for example, when we treat irritable bowel, one of the hallmarks is to give people a psyllium compound like Metamucil or Citracel, because that's soluble, consistent fiber. Now, insoluble fiber usually are raw vegetables, especially the leafy ones, lettuce, kale, spinach, cucumbers, that aren't that easily absorbed. Now, they're very healthy foods and they're important in moderation, but I think some people overdo the salads and miss the beans, the nuts, and the seeds,
Right.
and they're not getting the total nutritional package. And I think that's where a lot of my patients have issues, because they say, I'm eating a lot of fiber, but they don't distinguish between the insoluble fiber that can aggravate the irritable bowel initially and the soluble fiber that can improve it.
Right. Okay. So that's a good thing for our viewing audience to take note of, because as you said, the irritable bowel syndrome is, it seems like every other person has some issue.
They do.
And the older you get, the more you have more issues, you know.
The older you get, I think, but what I explain to people as I see high school kids, middle school kids, it's the stress levels and how they're moderated. So it's really a stress factor. Now, some people as they get older get less active, okay? Their diets may not be as good. They may lack social interaction. So some of the simplest things that our mothers always talk to us about are the most important aspects. And our bodies don't have to age as much as the numbers, as long as we, quote, take care of ourselves.
Take care of ourselves. Very, very important. You know, and I think you're talking about young people too. I know I'm just finished reading Michelle Obama's book and what she did with the garden there at the White House and so forth. But the reason that she even started that was that her oldest daughter, when she was younger, had went to the doctor and they said, you know, she's obese. You know, she's getting to that place where she's going to be one of the numbers of obese children. So something has to be done. And so Michelle started to look at the diet that she was giving her daughter and found that it was, you know, there were so many wrong things for kids, you know, things that weren't helping them but were hurting them. And I think that with the diabetes and everything else, that's something that, you know, comes along. You talked about prevention, and I know, you know, that you have some personal steps that you've taken with yourself and how you live. And I think if you would share that, some of that would be very helpful.
Well, one of my mottos that I actually include in my card is prevention by intervention. Now, intervention is taking care of ourselves. Now, some of the things I do, I exercise, but again, statistics show that you don't have to overdo it. Swimming for me has become a very important part of my life because it's relaxing. And in the breathing, a lot of people don't understand or are not aware of how important focusing on our breathing is. So when I'm swimming, I breathe in a very methodical way, and it's very relaxing. Listening to music is critical, okay? Socialize. Now we tell people that diet and exercise is important. More important than that is sleep. And the most important of all is social.
Right.
So I try to talk to people all day. People I meet in the hall. How are you? What's going on in your life? You know, men don't, especially men, I feel, do not talk enough. They don't have enough social interaction.
Right.
And
I think that's so true.
practicing certain things, whether it's just being quiet with yourself. I think some people take a look at meditation and they get a little bit miffed by it. But basically, it's just focusing on your breath, focusing on different types of breathing. And so I tell a lot of my patients to go on YouTube or Google relaxation breathing techniques. And there are a whole array of simple breathing techniques that if one practices them throughout the day, they can get more relaxed.
And you can put, if you're using phone, you can put an app on your phone, and it kind of dings when there's something. You take a couple of minutes out.
Breathe.
To breathe.
To breathe.
You know, yeah, to breathe.
To breathe and to move.
Right.
And to listen to music. Music,
Exactly.
it has very powerful messages to the amygdala of the brain and the endorphins and all the feel-good hormones.
Right.
Just like dancing and laughing.
Right, I know. And those are the things I think, well, I also take a yoga class, and I find that usually the teacher starts out with breathing and the different ways to breathe. And then, you know, you realize that you know, it just is so automatic. Then when you really focus on it, how many steps to breathe in, and then how many steps to breathe out. And, you know, it gives you a whole new learning curve.
And it also gives us awareness of who we are and why we're here. Awareness is such a potent word, but it helps us understand in simple terms about gratitude. Okay, and I also, believe it or not, as a gastroenterologist and an alternative medicine healer, I encourage people to keep a gratitude journal, which means every day write down 5 things that you're grateful for. I can see, I can hear, I can laugh. And when one does that after a couple of months, their life becomes very enriched.
That's such an important message. I've been doing that for a while, and I always say when someone, you know, even within my family or someone, a friend, and I said, you know, think about what you're grateful for and write it down, and kind of maybe even sit for a while with that, a person that you're grateful for, and, you know, allow that to come into your heart and be aware of your heart, you know, and that to build, you know, that gratitude within your heart. I think that's very, very important. So it really is encouraging for me to hear you as Dr. Larry talking about that. So that's great. That's wonderful. I want you to give our viewing audience a way that maybe they could contact you if they were interested.
Sure.
So,
Well, I can be reached, my phone number is 508-651-1998. You can reach me at email, lgastro, L-G-A-S-T-R-O, at AOL.com. And my phone number is 508-651-1998. And I'd be pleased and happy to talk to you about any of these issues.
That's wonderful, wonderful. I think some of the, what you were saying today, I don't know how did you decide early on that this is the field that you wanted to go into?
I decided in medical school, because in medical school we look at all the different areas and you see what patients are dealing with. And for me, it was nutrition and prevention. And gastroenterology has a great deal of focus on prevention of all sorts of illness, how to build up the immune system, and also how to eat sensibly and still enjoy your food.
Well, that's wonderful that you had that, you know, I don't know when you went through medical school, but you had that. I've been thinking that it's just recently that a lot of the doctors are paying attention to that and not just going to the drug. You know, let's look for the drugs. And that goes into a whole different area that we don't have time for today. But I mean, it's something that I'm always wondering about, you know. We're you can say heart disease or cancer or whatever the problems are that facing us health-wise. You know, what can we do to prevent some of this? You know, not just after the fact, but, you know, and I think what you're saying is the life that you live, the spirit that you have. You know, people will say to me, you're always laughing. And I said, well, and smiling. And I said, well, that's better than, you know, having a grouchy face and being crabby. You know, we all have challenges. So how do you face your challenges? Do they control you and destroy you? Or do you deal with them, I like that, step by step by step?
You have to go baby steps so that people feel that they're accomplishing something, and reinforce that and empower them to give credit to themselves for doing simple things.
Yeah, one of the things that we didn't talk about, but I wanted to, somebody said to me, well, what is GERD and how does that affect people? And I don't know if you want to just say a couple.
GERD is acid reflux, and it occurs when acid comes up the esophagus where it shouldn't be, because either one of the muscles is too loose, and so people can get symptoms ranging from heartburn to belching to indigestion, and it can present as a very severe burning. Sometimes it may occur with tart things like tomato sauce or even chocolate.
But again, the food that you eat.
It's the food that you eat, but I think there are some anatomic other causes of reflux. People who have too much weight, people who have too much stress, too much coffee. Again, it's the moderation aspect. The important thing is if you use the medicine appropriately, short term, and then get people to focus on the cause and lifestyle changes, that's where it is. The issue is if you're going to use medicine, don't use it that long.
Okay, and we have to stop. We're coming to the end of our program, but we have another program with you, so we're saying to our video, stay tuned. Namaste.
Namaste.
Namaste.